Hello everyone. I'm a much bigger kitty clinical than I was in the previous videos. Sorry about that, folks. It's just the way of the world. I think that there's some sort of glitch in the system or maybe a glitch in the matrix. I want to talk today about residents and how they view medical students. It is a hot topic because a lot of medical students might feel a little, what's the word, overwhelmed or maybe intimidated by their fellow residents. And I'm here to tell you, those residents only maybe a couple years ago were in the same boat that you were. Interns were medical students a year ago, unless they took gap years. But most of them, a lot of them, were fourth year medical students just 12 months ago. So keep that in mind. Residents, keep that in mind as well, because you're going to be having medical students that are going to shadow you, and how you treat them is going to impact how they view you as a resident, how they view the program that you represent, how they view their chances of getting into residency. And that's a very important topic. I think that a lot of people kind of look past. Residents view medical students differently. It depends on the resident. I can't give you a straight answer about how all residents view medical students, because different residents will view medical students in different ways. And not only that, they will view individual medical students in different ways. So you're going to have people who have a general opinion about medical students. Maybe they hate medical students, maybe they love medical students. I think a lot of residents do dread having a medical student, or maybe they feel like it's a burden, or maybe they feel like, oh, now I have to teach on top of seeing patients. It's tough, and what can the medical student actually do? They are just getting out of their basic science years. They're in their third year, they're in their fourth year. What can they really do? They don't have they don't have the training, they don't have the experience. They also didn't go through the match like you did. That doesn't mean, match doesn't necessarily mean that you're not getting trained in the match, but you're certainly getting interviews. You're doing all this stuff that medical students, maybe third years, haven't gone through yet. They don't know what that experience is like. So go easy, residents, go easy on your medical students. Medical students, know that your residents are very busy. They have a job to do, and you may very well be in the way of that job. So just be nice, be courteous, be understanding. Try to see it from the perspective of the residents being very busy. Residents are busy. They a lot of them could care less, honestly, of how, whether or not you leave early or not. But that doesn't mean you should take advantage of that fact, because a lot of people, me included, I like to have, get some help from the medical student. The medical student is an extra hand. They can see the patients while I'm working on my notes. They can give me a plan or give me the presentation, and that saves me a lot of time too. If they're a good medical student, it saves you a lot of time, because you can just tell them, go into the room, get a good history, and then all you have to do is go in and tell the patient, hey, I got the story from the medical student. They did a good job, and I know your story, and here's the plan. So I'd say that would be, residents, the smart residents, take advantage of their medical students in a way that also educates them, and in a way that makes them learn, and in a way that the medical student benefits you as a resident as well. So this is going to be a very complicated and very complex dynamic between the resident and the medical student. I hope you learned something today. If you don't know something, if you don't understand something about this video, I'd be more than happy to explain it in the comments. But leave a comment down below if you have any questions. Feel free to like and share, subscribe to my channel, and I will see you in the next one.